Should you be concerned about the Delta variant? Welcome to SBH Bronx Health Talk, produced by SBH Health System and broadcast from St. Barnabas Hospital in the Bronx. I'm Stephen Clark. The Delta variant of the coronavirus now exists in all 50 states, hospitalization rates spiking virtually everywhere. The variant is easily transmitted and already accounting for a majority of new COVID-19 infections in New York State and around the country. We're pleased today to have Dr. Ed Telzak, Chair of the Department of Medicine at SBH Health System and an infectious disease specialist, back with us on SBH Bronx Health Talk. Over the past 18 months, Dr. Telzak has walked us through the twists and turns of the pandemic. Welcome, Dr. Telzak.
Thank you very much. It's a pleasure to be back.
So first of all, if you've been vaccinated, do you have anything to worry about in terms of the Delta variant?
Well, I think we all have something to worry about with respect to the Delta variant and the whole family of variants that are likely to come after the Delta variant. I know you asked a very specific question. I would just like to take a step back and speak about viral variants more generally. So when viruses replicate, there's not always a high fidelity to their DNA in their progeny viruses, meaning when they're replicating, there are mistakes that are made. And when billions of viruses are replicating billions of times, there are many opportunities for viruses to make mistakes along the way. And some of these mistakes, I would say the vast majority of these mistakes have no meaning whatsoever. But on occasion, there are genetic mutations that occur in viruses, and in particular with the SARS-CoV-2, that occur in the spike protein, which is the area of the virus that attaches and is largely responsible for the transmissibility and how pathogenic the virus is. So these mutations result in many different kinds of variants. And the federal government, Health and Human Services, has put together this SARS-CoV-2 interagency group that is rapidly characterizing the many different variants. These variants, they've categorized them into three categories. There are variants of interest, variants of concern, and variants of high consequence. And basically, as we move along that continuum, we should get more and more worried. So what we're talking about today really are variants of interest. And we're talking about variants of concern. Right. And the variants of concern become variants of concern because they may be more transmissible. They may cause some more severe illness, hospitalizations, death rates might be higher, and maybe therapeutics or vaccines may be less effective. If you have any, or diagnostic, our standard diagnostic tools, PCR, for example, may not work as well. If you have any of those characteristics, that variant becomes a variant of concern. The Delta variant is a variant of concern. It's a variant of concern because it's clearly more than twice as transmissible as the original Wuhan strain, which is what infected this country in the spring of 2020. The question of whether it causes more severe illness, I think, is still unsettled. And though vaccines remain very effective, they're not as effective as they were when they were originally tested on the Wuhan strain. So in some of the Delta has characteristics that make it a variant of concern.
Okay. But having said that, if you have been vaccinated, fully vaccinated, I mean, should you be kept up at night saying, well, geez, I got to be careful where I'm going. I need to wear my mask. I need to stay out of the supermarket. Or are you relatively safe?
Right. So I would say right now, if you're fully vaccinated means you've received 2 shots of either the Pfizer or Moderna, or 1 shot of the Johnson & Johnson. Those are the approved vaccines in this country. And you've had 2 weeks after the last dose. So that's fully vaccinated. It's clear when you receive only 1 shot, you're at high risk for Delta infection.
Right.
If you're fully vaccinated, you're at significantly lower risk of becoming infected with Delta, although what that risk is still has not been settled. And so, for example, in Canada, in Britain, where there is a fair amount of Delta, it's felt that if you're fully vaccinated, you have about 80% protection from getting infected. In Israel, their analysis is lower. They think it's about 65% protection. But what everyone has found is that if you get infected with Delta and you're fully vaccinated, you're much, much less likely to get sick, much, much less likely to be hospitalized, and your risk of death is extremely low. So what we're seeing is that vaccination, even if you're infected with Delta, still prevents you from developing a severe enough illness that results in hospitalization and death. And that's the real power of the vaccine.
Right. Now, I know you're talking about Israel, and I read that the Ministry of Health was concerned enough about, I guess, the waning efficacy of the vaccination and are now providing booster shots to a lot of the population. From what I've read, while Pfizer is interested in doing it, the CDC is hesitant. What's your feeling on that?
Well, I think first and foremost, the pharmaceutical company should not be the one that makes recommendations about getting a booster shot of their particular vaccine. It should really be the federal government, so the CDC, the NIH, the Department of Defense. Really, there are agencies, the FDA, there are agencies that are looking at the data in real time. Israel is recommending a booster shot for patients who are very immunosuppressed, as opposed to a more generalizable third vaccine for everyone. It's pretty clear that if you're very immunosuppressed, you have a malignancy, you're on chemotherapy, you're on chronic other immunosuppressive drugs because of lupus or similar conditions, that the vaccines do not work as well, that the immunologic response that the vaccines elicit in a normal host are not as good if you're immunosuppressed. They're also, by the way, not as good if you're older. And so younger people, they actually have more side effects when getting a vaccine, and the side effects are really a measure of the immunologic wherewithal to respond to a vaccine. So right now, Israel is only recommending a third dose for those who are very immunosuppressed. And there are doctors in this country who are also recommending a third dose for those types of patients, the patients with those conditions. But I think at the moment, the vaccine after 2 doses, and then the vaccine after the Pfizer and Moderna, and then after 1 dose of the Johnson & Johnson, seem to be highly efficacious. And in particular, this past week, Johnson & Johnson published a study in the New England Journal that was peer-reviewed that showed that 8 months out, the vaccine in vitro still is highly potent against a Delta variant. So for the moment, I would say no booster shot, and which leads me to another issue, which is that though in this country we have plenty of vaccines, and if people needed a booster shot, we could give them a booster shot, in much of the world, there remains an incredible shortage of vaccines. And I think the one thing we're really learning about the Delta variant is what happens in India, what happens in South America, what happens in sub-Saharan Africa. Those variants will very much affect us at some point in time because people are traveling again. And that we should utilize our vaccines to try to immunize places that have large outbreaks. Because as long as there are large numbers of patients with COVID, additional mutants will arise. And as these mutants arise, some will be mutants, some will be of no consequence. Most will be of no consequence, but some will be variants of interest, some will be variants of concern, and right now there are a number of variants of concern in addition to the Delta virus. We don't have any variants of high consequence. That's where the vaccines don't work, the therapies don't work, those don't exist, but clearly that's a fear and a potential, that clinicians, scientists, people involved in this field are concerned about. And so I would say, use our third doses to send abroad so that we can begin to vaccinate and have vaccine in many of the countries that are now in the midst of major outbreaks.
Okay. Is there any, from your perspective, is there any way of knowing that some of these vaccines of high consequence are around the corner, or is it just we're going to wait till it hits us in the face and then have to deal with it?
No, so they're variants of high consequence. And, up until very recently, the United States was not genetically profiling the viruses that were circulating in this country. It's a relatively new phenomenon that probably started within the past year. Britain was doing it, France was doing it, but the United States was not. Now the United States is very actively engaged on a federal level, but also many state health departments, many university laboratories, many city health departments, the New York City Department of Health are actively engaged in seeing what the dominant viruses that are circulating, what illnesses they're causing, and genetically how they differ from strains that are already cataloged. And so it's not that we'll know about it when it hits us in the face, but as additional mutations accumulate in the spike protein, and we know some mutations that already predict certain consequences, and as additional mutations are cataloged, we'll begin to get more concerned. And we'll see a case or two or three, and so I think it will be a gradual process. But what's very important and what's very consequential is that we are now catalyzing many thousands of strains that are circulating in this country, across the country, and really across the world. And so we're much better prepared to know when a dangerous mutant will arise.
Okay. I know you play poker, but I don't know how much of a betting person you are. But if you had to put a bet on it, are you saying that we're not out of the tunnel yet? That, while, people are going to ball games again, people are going to concerts. I was at a meeting yesterday in a hospital where people weren't wearing masks, that maybe we're jumping too far ahead.
I'm concerned. I'm concerned because there are a number of things happening at the same time. There is the development of the Delta strain and perhaps other variants of interest, but in particular, the Delta strain. At the same time that society, really in many places across the world, are opening up, and opening up in no uncertain terms. I think the combination of that plus still fairly substantial proportions of the population that are not taking the vaccines. And I think those three things all together make COVID something that we will be dealing with in the near, mid, and I dare say long-term future. I think we are not out of the woods. Now, having said that, certainly for the near-term future, I'm not nearly as concerned as I would be because of the vaccines and because they're still very efficacious, that we're going to return to a time such as the spring of 2020 in New York City, where we were overwhelmed. I think that's not what we're looking at. But we're looking for and expecting that in areas, it could be as small as a zip code, it could be as large as a county in Missouri, Louisiana, where there are large numbers of unvaccinated adults and children, where more than 55, 60% of the population is not vaccinated, where there can be outbreaks, and there are outbreaks now. In New York City, what we're seeing are rates that were about, rates of positivity that were about 0.5% 3 weeks ago that are now 1.5%. So still very low, but, of concern. 1.5% is what we were seeing last summer. We were seeing less than that. But summer is our best time. We're outdoors, we're not indoors. And if we're seeing a tripling of the proportion, let's say, in New York City, even though the rates are low, that I think is gives me great caution.
Right.
And we're fully opening up. And so I'm worried about our institution. I'm worried about the communities that surround our institution. Vaccine rates, and if I can just use a little cheat sheet here. So adults that are fully vaccinated in the Bronx are 56%. Brooklyn is 58%. It's 10% less when you look at the entire population. So more than half the population in the Bronx and in Brooklyn are not vaccinated, and those numbers are even higher. They're in the low, ultimately in terms of a population not vaccinated, they're in the low 40s, low 40% when we look at the total population of the Bronx and the zip code surrounding our hospital. So the majority of people are not vaccinated. And, we could say, well, maybe we have a little more room to move in the, 12 to 17-year-olds. It's relatively new for them. Hopefully, towards the end of August, beginning of September, the 5 to 12-year-olds will be eligible for vaccines once the safety profile is proven, which I'm almost sure it will be. But vaccinating, the 35 plus 40% of adults who have resisted vaccines, when they're readily available by and large, is a real challenge for us. And that gives me great concern also.
Is that going to change? Do you have any faith that more people will decide to get vaccinated, or have we reached the people up to now who are interested in getting vaccinated, and it's just going to be downhill moving forward?
Well, I think, people reject vaccines for a variety of different reasons. There are in certain groups, the conspiracy theorists. I think in our population, there are people who have distrust of the medical system because of how they've been treated over, decades by the medical system. I think there are individuals who feel still that the vaccine was developed too quickly, and that even though 200 million people have gotten the vaccine in this country, still The safety has not been proven. And judging risk is a very challenging thing. And we hear an enormous amount about, the risk of vaccines. Guillain-Barré last week related to Johnson & Johnson vaccine. There were 100 cases. 13 million people have gotten Johnson & Johnson. That's lightning striking level risk. And yet the risk of COVID is very real, is very tangible, and is potentially life-threatening. And those two risks proportionately should not be equated, and yet often are. I do think there's a little room to move. I think the wrong people have been spokespersons for the vaccine. I think there need to be more African-American spokesperson. There need to be more ministers, more imams that are spokespersons for the vaccine. And I think, there is in the single digits more. And I believe that if the Delta variant has a great impact on those who are unvaccinated, I think that will also convince a group of people to become vaccinated.
Do you fear, I know Dr. Fauci said the Delta variant may result in two different Americas, those who have been vaccinated and those who haven't. And the concern I would have is even if you're in the country that has been vaccinated, we don't live in isolation, we travel, so we may be affected by that as well. What do you feel about that?
Meaning, so is your question, if you're vaccinated, are you still safe?
Well, that was the original question, but even if we have two Americas, one that is vaccinated, one is not, those who are vaccinated are going to be at risk simply because we travel, we come into contact with people from Missouri or from Arkansas or from Louisiana, where the rates are like, 30% or something. That would give me cause for concern.
Right. Absolutely.
As an infectious disease doctor, I'm sure you feel the same way. We're thinking.
Right. I think people who are vaccinated, once again, they can get infected. They're by and large protected if the vaccine works. But we've already mentioned groups of people that the vaccine doesn't work so well. If you're immunosuppressed, there are 10 million people in this country who are severely immunosuppressed between or among transplants and cancer and chemotherapy and connective tissue diseases and people on, there are new immunosuppressive agents being developed all the time for a variety of illnesses that are not malignancies. So that's a very large group that's at risk. The elderly remain at risk. They don't have the same, I use the term immunologic wherewithal to have as high and as durable an immune response against the vaccine. So yes, a vaccinated person carrying the virus can transmit that virus, probably at lower levels, but can still transmit the virus to vaccinated people, let alone unvaccinated people, but vaccinated people who have not had the full benefit of the vaccine because of immunosuppression and or age.
If you're immunocompromised or you're older, does it make any sense to get your antibodies checked to see if you are protected?
I think that's going to become the standard at some point. I think it does make clinical sense that if we don't really know what the threshold is for, effective antibodies, and there are lots of different antibodies that are being measured. But I think if you don't have an immune response, that would be an indication for me to advise that individual to wear a mask, to remain socially isolated, though with increased transmissibility, wearing a mask and being socially isolated may not have the same impact as it had earlier in the pandemic, but to also consider getting a booster shot. And it doesn't necessarily now, England in particular has been doing a number of studies, and lots of different countries are now mixing and matching vaccines. And there seems to be some benefit. The concern initially was that the effect wouldn't be as potent. but there actually seems to be some benefit, at least in small early studies, that, using in England, for example, they might use a Pfizer followed by an AstraZeneca, and that seems to give a very broad-based immune response.
So do you think mixing vaccines is okay? I mean, if you had Johnson and Johnson and suddenly you're a little bit concerned about, maybe the side effects, and you are older or you are immunocompromised, and we have Pfizer shots available, would you recommend you mix and match?
I would wait for the FDA to recommend. I don't want to get too far ahead, except to say that there are small studies, mostly done in England, that show benefit of mixing and matching. And part of the reason they mixed and matched was because of vaccine availability. And that's why it's being done in many other countries out of necessity. We are in a fortunate position where we can get, a second Pfizer shot. If we got Pfizer, a second Moderna shot, that's really where the data are. And so, I would not make that a broad recommendation at this point. I would really wait for the FDA to make that sort of recommendation. But on an individual level, that might be something to be considered.
If you have young children who are below the age of 12, should you be concerned about the Delta variant? Should you make sure they're not in situations where there are a lot of people not wearing masks or not socially distanced? I don't know when. You said the vaccines may be coming in the fall, but in the meantime, these children are not protected through vaccination. What would you suggest?
Right. So that's a very complicated question. We know that kids who get infected, especially younger kids, less infectious than adults, and they don't have the same severity of illness as adults. I'm not sure we know that fully yet about infection from the Delta variant, but in general, that seems to be the case. It doesn't mean that some of them can't transmit the virus if they get infected. And so I would say that and schools will be opening up in the fall. CDC has sort of given their blessing that there should be classroom learning. They've sort of added the caveat that individual counties, cities, and states need to make their own decision. But they basically feel like with some degree of social distancing and mask wearing, that kids can go back to school and can have in-class learning. And I think that's probably reasonable. That if a young child is going to a very crowded situation or a crowded situation, wearing a mask is probably a good idea. And once they're vaccinated, they no longer have to wear a mask.
Okay, let me ask you to summarize what we've been talking about. If you've been on the fence about getting vaccinated, should the Delta variant pull you off that fence?
I think there's nothing that at this point in time that you can do for your health that's more worthwhile than to get vaccinated against COVID. And I'm saying that for everyone who's eligible for the vaccine. And that means being fully vaccinated, getting both doses of vaccine. That's the single most important thing that you can do for yourself. It's the single most important thing you can do for the people that are around you, for your family. And it's the single most important thing you can do for your community and our city, state, and country. I cannot emphasize that more strongly. Getting a vaccine is critical. And it's such a tragedy to me to see people hospitalized, very sick, people dying, all the deaths, the overwhelming majority of hospitalizations due to COVID are happening among unvaccinated individuals in this country. And it's a preventable disease. And every time we lose someone to COVID, it's someone that we should not have lost. They should have gotten vaccinated. on a personal note, it's a very sort of painful thing to see this great advance in science to be immersed in the political machinations of the day, such that people are not availing themselves to this really great advance.
Okay, well, Dr. Telzak, thank you for some time today. Hopefully, we won't have to discuss COVID again anytime soon, which from what you're saying seems unlikely. But again, thank you for joining us. I also want to thank our listeners for joining us. For information on services available at SBH Health System, visit www.sbhny.org. Until next time.
Thank you very much. I enjoyed speaking with you.